During your evaluation for refractive eye surgery, in refractive eye surgery I mean procedures such as LASIK, sometimes the evaluation can reveal that the person has a deformed cornea. One of these types of deformed corneas is something we call keratoconus. And keratoconus is a thinning and steepening of the bottom part of the cornea. If you're diagnosed with keratoconus, it may indeed prevent you from having a LASIK procedure, because we feel that performing LASIK in these situations may make the keratoconus, or this underlying disease, worse. Is there any opportunity to help these people then? Yes, there is. Historically, with keratoconus, we had to rely, at least from a surgical standpoint, on doing corneal transplant. And that's where we took the old cornea off and placed a new cornea into the patient's eye. This obviously came with certain risks and was a major surgery. These days, the original way that we, in general, address a keratoconic cornea is the implantation of intact rings. Intact rings have been around for a long time. They were originally introduced for the correction of just straight nearsightedness. So people who were nearsighted would come in, and at least at that time, instead of performing LASIK, we would place these intact rings. And intact rings are nothing more than these small, sort of semicircular plastic ring segments that are implanted into the cornea. Initially, the intact rings were used for the simple correction of nearsightedness or myopia. So instead of a person coming in and having LASIK eye surgery, they would have intact rings placed to correct the underlying refractive error. With the advent of LASIK, the use of intact rings for the simple correction of nearsightedness has sort of fallen by the wayside. Where intact rings now have become a very prominent part of our armamentarium is in the treatment of keratoconus. The intact rings really are placed into the cornea in a simple 5-minute procedure, and it addresses the underlying irregularity of the cornea that's seen with a keratoconic patient. So the intact rings provide a stabilizing force to the keratoconus, and thereby, at least we hope, prevent you from needing a corneal transplant somewhere in the future. In addition to helping out the keratoconus, however, keratoconic patients are also frequently myopic. So the implantation of the intact rings, in addition to helping the keratoconus, will also help out with the correction of the nearsightedness. So you sort of get the two birds with one stone effect. The recovery phase from intact rings is quite simple. You have a bandaged contact lens placed for a few days. That is removed at that point in time, and then your eye is simply allowed to heal. There really are very few restrictions placed on the patient following the insertion of these rings, and patients can generally resume their normal lifestyle within a couple of days. Now, the recovery from the intact ring implantation is typically longer than what it is with LASIK. Frequently with LASIK, you see well the day after surgery or fairly soon. With the intact rings, the recovery in a keratoconic patient can take several months. So one has to be relatively patient with the recovery of their vision. We are here to guide you through that process and help you see during the transition. If the intent is to be able to see without glasses, frequently we can employ a laser-based refractive procedures such as PRK to correct any underlying residual prescription after the intact rings have been placed.